Thank you, everyone. Thank you. Good afternoon. Thank you, Madhavi ma'am, Parth, Kushal, and Alai sir for an excellent meeting. This is a talk sponsored by Novartis, though all the cases are my own and the company has nothing to do with it. For the meeting, for the meeting. Yeah. Uh, as we know, Brolucizumab was introduced in India in October 20, and about a year before that in the US. Initially, we used it only in desperate bad cases where repeated injections were needed and people were tired of giving injections. And from the beginning, the Brolucizumab had an advantage that we could space out the injections, so there was no loading dose. And gradually now we give in a lot of naive cases. In fact, some patients who are chronic patients ask for it actually in the other eye also. Now, straight to the cases. This is an interesting 78-year-old active surgeon who had a lot of treatment before in his only seeing eye. One eye was lost to neovascular exudative AMD long back, and he stopped responding to ranibizumab, which was Lucentis at that time, so long back. And left eye was getting regular injections about 5 to 6 weeks apart, aflibercept. And he did recover every time, but he needed injections all the time. And he was a bit tired of it. This was his right and left eyes. The right eye was atrophic, a lot of RPE atrophy. Left eye also had sick RPE with an occult type 1 CNVM with a choroidal cavern or gap with recurrent intraretinal fluid now and then, for which he needed injections. So the picture would become like this after about 5 to 6 weeks of aflibercept back in 2019. At that time, we got a supply of the first Brolucizumab, probably before Paginex was launched in India. And he responded quite well when we started using it. And the good part is the interval between the injections where we were able to increase it to 10 to 11 weeks actually. So these are OCT angiograms showing the neovascular network responding to Brolucizumab. And this is a recent photograph after 29 injections of Paginex over last 6 years or so. And he's maintaining 6/9 part vision and he's operating at the age of 83 in his 40. I'll skip the second case. This is also a bilateral PCV, one old, one recent, and the recent PCV responded so well to Brolucizumab that the patient wanted injection in the other eye, and that also responded very well, which has been proved in the Hawk and Harrier studies. Not only the AMD, Brolucizumab is also used in DME. It has been approved. And in complex cases where multiple injections have been required, especially Ozurdex in steroid responding patients, Brolucizumab is a good option to reduce the number of injections like this diabetic macular edema, which waxes and wanes. And this has also been proved in the kite and kestrel studies. So Brolucizumab is a smaller molecule having larger concentration and greater efficacy. The question, of course, remains what about the side effects or intraocular inflammation with Brolucizumab every time. We have this publication in the Indian Journal in a big multicentric trial across 21 centers where the intraocular inflammation in Indian patients have been shown to be much less than 1%, 0.71% to be precise. In my experience, few cases of vitritis, mostly asymptomatic, and responded to topical steroid. In the early days, I got scared of one case. I did a precautionary vitrectomy. It did well, but there is definitely more drying and a longer course of action, leading to lesser number of injections with Brolucizumab. Well, thank you very much.
Yeah, thank you, sir. This question. Yes, with this.
I have some more cases, but due to lack of time, I've cut it down. Yes,
This.
Dr. Ali. Ashish.
I dare not speak in front of the capital of Pagenex in India, Rajkot. Just to say, I have seen dreadful cases of side effects of Pagenex from Rajkot, from all surgeons who have given. So it's not that it is not there. And it's your worst cases never come back to you. They always go to the others. So similarly, my cases with other anti-VEGFs who have had complications might have gone elsewhere. So that does not mean I do not have a complication. But of that I have seen, they're dreadful.
There are maybe some cases, but there has been a large trial, 21 centers, big centers. They've done multiple, so 2,000 odd injections.
No, what I'm trying to say, we've seen side effects with every anti-VEGF that we've used, including Vabysmo, Eylea.
Yeah, we're not saying it is zero.
Yeah, yep. But the occlusive vasculitis cases that we've seen with Pagenex, it's very, very scary. And I've seen about 7. And if you see those cases, you shiver. So it prevents you from using that molecule unless, as you said, the patient themselves ask for it. There are patients who have taken it elsewhere and they would say, no, I would like.
I have a few patients who have been asking for it repeatedly. This doctor got 29 and there are many others who got more than 10 actually.
Yeah, thank you, sir. Let's move on to the next presentation.
Ashish wanted to, he's been standing. One quick question. Yeah.
Can it prevent such adverse reaction?
No, I don't think it is necessary because we cannot predict. Some people, if they get, then they need to be treated, not before.
Okay.